Hello, everyone. Welcome to the Rewind podcast. Steven, welcome.
Thank you.
Everyone, this is Steven Devos. He's a doctor. He lives in Belgium. He has his own YouTube channel. It's called the TRT and Hormone Optimization channel. Please follow him. He has great content. I'm very appreciative for you joining the show and answering the questions because I think there's so many misconceptions about hormones and testosterone. And having someone like you who's a huge advocate who started your channel to educate people is amazing for all the people that watch my own channel. So thank you for being on the show.
My pleasure.
So my first question is that most people who believe when someone is in shape believe that they must have really good hormone levels, but that's not always the case. I see that with some of the clients that we get because I'll get guys that come in and maybe they still look like they're in really good shape, you know, relative to everyone else, but internally they don't feel well. They feel like they should have much better results and be in much better shape than they are, and they're dragging from an energy perspective. So I think it would be helpful, you know, could you tell me a little bit about your story, why you started the channel, why you got interested in testosterone? Because I think it's going to be really helpful for a lot of people.
Yeah, sure thing, Brian. Thanks for having me. So I'm 48 now, and 5 years ago, in 2017, I, for the first time in my life, started to experience some symptoms of, the typical low T symptoms as we know them now. So lower energy, less drive to train, lower libido than usual, lower stamina, lower endurance as well, because I remember I went cycling with my daughter that was 10 years then, and I couldn't keep up with her. So I really had no energy, and I didn't know or didn't realize what was going on. Even as a doctor, I asked myself, oh, what is going on? But I had some thoughts in the back of my mind, so I said I will do a blood examination. So for the first time in my life, I checked the hormones on the panel. So I asked for the testosterone and SHBG and so on. And I was actually not really surprised that the total testosterone came back at 228 nanograms per deciliter something. So even below the normal range, that is already very wide, from 250 to 950 here, something. So I had actually the testosterone levels of a 80-year-old man probably. So that explained for me what was going on. So at that moment, even as a doctor, I'm a dermatologist, I didn't really know what to do. So I contacted a urologist, some guy that I know here in my town, and I went to him and he said, I don't have a lot of experience with young guys with these kind of troubles, but for the older men, I give them androgel. So he started me up on androgel, and I didn't know any better than just trying that. And that put my levels up from the 228 up till 300, 350, something like that, but it didn't change my symptoms at all. So I went back and told him that after a few months, and he said, well, give it time, and he upped the dose of the androgel, but it never really worked. So at that moment, I started to doing some research online myself. So I got into contact with the several men's health clinics that are available in the United States, because here in Europe the information and the knowledge about it is very poor, and it still is. So I got in contact with several doctors online, and being an MD myself, they were very helpful at interpreting my lab results, and they proposed to start me up on the cream, so compounded testosterone cream. So that's what I immediately started on. So I asked for the exact formula. I gave that to my pharmacist. I can prescribe myself. In Belgium, it's allowed to prescribe yourself and for your family the medication, so that was not a problem. But I told it to the urologist, and he said, well, it's transcrotal absorption, so you have to put this compounded testosterone cream on the scrotum twice a day. And the urologist actually laughed in my face, and he said, on your scrotum. So he couldn't even believe this was a thing. So
Right.
yeah, I didn't contact him after that anymore. So I just went on with the compounded testosterone cream, and it really worked. So I really felt better in a couple of weeks, maybe a month, month and a half. I had my levels checked, and they were 900, 1000 nanograms per deciliter, probably as they were when I was much younger. So I immediately felt all the differences. The libido came back, the drive to train, the endurance cycling with my kids, everything changed since then. And I always stayed on the same protocol, using this transscrotal compounded 20% testosterone cream twice daily. And that's the moment when I realized, well, we have to educate other men. There must be surely a lot of other men with the same symptoms as me. So yeah, I contacted several of the doctors that are still on the channel, and some of them proposed to do regular interviews with all the frequently asked questions concerning TRT, and that's how we started the channel.
That's great. I try to do a lot of education with my with our clients here, and we have one of the studies. There are not that many studies done that break out testosterone levels by age bracket. One, interestingly enough, is from Belgium, and it was done in 1996. And so at least when we, first of all, we optimize based on more the 25 to 30 year range, because if you take a look at what the great athletic years, when men are at their best and when they feel their best, it's typically in their sort of mid to upper 20s. And so we sort of use that as a range, and then at least we'll be able to explain to people that when they come in and they're 300-400, we can look at it from a demographic perspective and tell them they're in the bottom 10%, bottom 15%. And so obviously they're going to see, the results when they work out, exercise, and how they feel as being someone in the bottom sort of percentiles. So, we also try to educate. Our highest, by the way, natural person who walked in off the street had 1,500. His testosterone level was, 1,500. So we sort of know that this range is broad. And I think yours would be one of the lower ones that we have. We get occasionally we'll have someone in the 100, 200 range, but more in the 400 is, I would say, the 400 to 500 range is quite common. But to be optimal and in the top 5% requires over 1,000. So we sort of try to do exactly what your levels are at now, 900 to 1,000, and guys feel much better, I think. I don't know if you know this, but the average male testosterone, at least in America, levels are down 20% from 20 years ago, regardless of age. Yeah, so the average 60-year-old is 20% lower than the average 60-year-old by 20%. The average 30-year-old is 20% lower. And these levels, I think, because they loop in so many unhealthy men and we're becoming so unhealthy, the levels are dramatically lower.
Yeah, and the lab ranges came down with them.
Exactly. And I think that I have my LabCorp test results from 2017, and the range was 350 to 1,200, and now that range is 260 to, I think, 920.
Yeah.
So it's less justification to consider someone low.
Exactly. Yeah.
And, it's a big game in America with the insurance companies of what they'll pay. What do they deem as low testosterone? When can we put someone on therapy? And I think too many doctors are preconditioned to only do it based on numbers and not symptoms. What if you can't lose the fat, if you're having a harder time from a libido perspective, your erections, we hear this all day long, how guys are having less erections, they have lower libido, they're tired. I always say that if you need a nap at 6 o'clock at night after dinner, what's the likelihood that you're going to have a strong libido when you go to bed at 11 o'clock? Sort of common sense.